Hello and welcome to Local Doctors on Call. I'm Wendy Mann-Resnick. They don't hurt, they really don't take a lot of your time, but they can be so important to you. Join in our conversation tonight as we talk about the importance of eye exams with Doctors Kathleen McCabe and Susan Beck. Dr. Beck is a board-certified optometric physician seeing patients here in Sarasota, and Dr. McCabe is a board-certified ophthalmologist and a cataract clear lens replacement and LASIK surgeon at the Eye Associates. Welcome, ladies. So fun to have you here tonight.
Thank you.
So, Dr. Beck, if we think that we have great vision, why is it necessary to have an eye exam every year?
Well, that's a good question, valid question. Routine eye exams are important regardless of your age or the overall health or how well you see. Besides looking to see how well your eyes are doing in terms of your vision at the eye exam that you go to, your eye doctor is also looking to see how well your eyes work together, how well they function as a team together, how well they function. But they also are looking for things inside your eye that can indicate your overall systemic health and your well-being. And in fact, oftentimes it is people's own eye doctor who are the first physicians to actually notice some chronic disease or disorder that's going on inside your body just by going to the eye doctor.
Interesting.
One of the cool things about an eye exam is that we actually get to see your blood vessels. And this is really the only place in your body, hopefully, that you can look directly at the blood vessels. And so if you have a disease process that affects those small blood vessels, we can actually see that.
And is that when you dilate our pupils?
Exactly. That's when we see the back of the eye and we see where those blood vessels are.
Without having to cut you open. So that's
Yeah.
a plus, yes.
That's a good thing.
Yes.
Definitely a plus.
I don't like to be cut open.
Yeah.
If you would like to join in our conversation tonight, ask a question. It doesn't have to it doesn't have to be about eye exams, but anything to do with your eyes. Just give us a call at 361-4675. This is like your opportunity to ask two brilliant physicians about your eyes, and you can just do it from the place in your own home where you're the most comfortable. So give us a call and ask your questions. And so in a comprehensive eye exam, what does that include exactly?
So comprehensive, as you might imagine, means just everything. We look at it all. We look at the outside of the eye. We look at the area around the eye, the skin around the eye, your lids, the position of the lid, how they function. Sometimes we look and see bumps and little, abnormalities that you might think, I wonder if this is something that's worrisome or not. There are some skin cancers that have a predilection for the lids, and we can look at that. We look at the surface of the eye, the window in the front, the cornea. We look at your natural lens, whether or not you have any cataract forming. And then we dilate your pupil and look in the back of the eye where those blood vessels are, and we can see the health of the optic nerve.
And how long does a comprehensive eye exam usually take?
Well, it just depends on what's involved, but there's also checking your vision, checking you for glasses, and checking your pressure as well. So typically that can take, along with dilation, plan on being there about an hour or so. And
Yeah.
what do you tell patients?
Yeah.
Same sort of thing.
Basically about an hour, and I just always stress every time they've had their eye exam that I will see you next year for your routine eye exam, whether or not you have a problem or not. We just schedule that for them to make it easy for them. But I always tell people 1 hour once a year can make an overall difference in the health of your own body, your vision, and your overall quality of life. Just by that 1 hour investment once a year.
It's a good investment. And
Yes.
we have Yvette on the line. Yvette, you're on the air. What is your question?
Yes, I just wanted to know, with the dilated exam, what type of conditions or health conditions are you able to diagnose through? Because I always hear people saying that you need to have, that you should have a dilated eye exam, and what pre-existing conditions, if you do have, should you be followed by having a dilated eye exam?
Yeah, that's a great question, and we do want you to have a dilated exam once a year, and some of the things that we look for that aren't necessarily completely eye-related are, changes in the blood vessels that might indicate diabetes or high blood pressure, and we can look for things that are even sometimes systemic inflammatory diseases like sarcoidosis and things like that can have manifestations in the eye. And then we look for specific eye diseases that we can only see inside the eye, like macular degeneration or diabetic retinopathy, or even monitoring the health of the optic nerve for glaucoma. So it's a critical part of the eye exam, actually, to have that done once a year. So great question.
Thanks so much for calling in, Yvette. And we have Bob on the line. Bob, you're on the air. What's your question?
Yes, ma'am. When I close my eyes, especially at night, and they have to move quickly, or if I wake up in the middle of the night and the room is dark, I will see almost like lightning bolts in both my eyes. And they are very uniform. It's almost like they start from the bottom of the eye and they go straight up, and it's the same in both eyes. And I was just wondering what is causing that.
Yeah, we call those, flashes, actually. That's typically when we're asking a patient if you see flashes. That's the kind of thing that we're describing. And the back of the eye is actually filled with a gel. And that gel is called the vitreous, and it's attached to different structures inside the eye, around your optic nerve and to certain areas of the retina. And when you move your eye quickly, it actually moves that gel, and that can tug a little bit on the retina. And the only thing that your retina has, it doesn't have pain fibers, so you're not going to have a little feeling of pain or pressure, but it does, when those cells get excited and activated, they give off a little sensation of light, and so you see a flash of light instead. Now, if you see consistent flashes of light that are different than what you've normally experienced, or especially if they're accompanied by a new onset of a shower of floaters or cobwebs in the eye, then you want to let us know right away, because that could indicate that that little tugging on the retina didn't just cause you a little light show, but it actually caused a tear in the retina. And a tear in the retina that's not diagnosed and treated early can lead to a retinal detachment. So the sooner you come in when you're noticing something different, the better. But if you notice them all the time and they haven't changed, that's fine. You're okay that way.
Thank you for calling in, Bob. And we have Larry on the line. Larry, you are on the air. What is your question for Dr. McCabe?
Dr. McCabe? Hi, how are you today?
I'm doing well. How about you?
All right. You did my cataract surgery back in February. I had 2 retina surgeries prior to that.
Yes.
And I'm getting the cataract in my left eye. But Dr. Casper keeps telling me that it's not big enough to operate on. But my question is, my eyesight isn't going to be any better for the next 3 or 4 years until that gets big enough. And I'd like to get it removed so I can get my eyesight back in both eyes even. I'm having so much problem with the distance of my eye.
Sure. Well, it sounds like you have a more complicated than the typical patient who's developing a cataract. And you know that cataract surgery is pretty easy, pretty quick and painless procedure to have. So if it's warranted, of course we wouldn't withhold that surgery from you. But I suspect, and of course I'd need to take a look at your eye to know for sure, but I suspect that Dr. Casper believes that your cataract is at least equal to or less of the problem with your distance vision than your retinal situation is. And because it's the same or less of the problem, if we take out your cataract, you may not notice any visual benefit. So when you have a couple of different things going on in the eye at the same time, we try to figure out if at least the cataract is slightly more than the other problems so that you'll see some benefit from taking it out. But the best way to tell and for me to really answer that question is to see you in the clinic.
Thank you so much for calling in, Larry. And if you have a question, please give us a call at 361-4675. So, Dr. Beck, is there a specific age or age range where it's best to start having your eye exams?
Well, eye exams are important at every age, from infancy up until senior citizen age. Infancy, it's important to make sure that children don't have some pretty severe things that babies can have, like a white pupil or severe eye turn, which will greatly diminish their abilities to see and function as they get older. School-age children, it's important to make sure that their eyes are working together and focusing properly so that they can learn well in school. And kids have a remarkable ability to overcome a really strong prescription. So they might have a problem and they might not ever even know about it because they don't really know what normal vision looks like. So it's important to get them in to the clinic to make sure that we're not missing anything. Young adults and teenagers, they're going through big growth spurts and hormonal changes, and that can greatly affect how your eyes change and how well you see. And then, of course, working age individuals, that's when early problems can start to develop, and that's when you want to catch them, is when it's at the beginning stages, when it has very low impact on your vision and your lifestyle, as opposed to catching it when you're a senior and then there's not a lot that can be done. And of course, senior citizens, it's important because that's when, you know, a lot of problems can happen, and if you'd been getting checked all along, they're not going to be nearly as devastating as if you come in for your first eye exam when you're 65 and the motor vehicle said, I won't renew your license until you come in.
And
So
oftentimes that's when we see patients for the first time because they may not have needed glasses. They got by with over-the-counter readers, and they really thought they were seeing okay. And then the driver license department told them, nah, you're not.
and they make them take a cab home. Yeah.
I was very happy when I passed my eye test at the driver's license place, actually. So we're going to be back in just a minute, so stay tuned.